Does your dog grunt? What is grunting? Grunting is a low, short guttural noise that is made by a short exhalation of air. It is generally a more forceful exhalation than a sigh, but a less forceful one than you would find in a cough. Grunting can be a normal vocalization in canines, and is often simply an expression of happiness and relaxation, or a bid for food or play. The attitude of the animal, however, as chronic grunting, grunting that is unusual to your animal, or grunting that is accompanied by other signs and symptoms may indicate more serious disorders which may require veterinary attention. Reasons your canine may grunt are communication, gastrointestinal problems, laryngeal paralysis, pain, respiratory disorders. Why grunting occurs in dogs? There are many reasons that your canine may be grunting. In the majority of cases, grunting is nothing to be concerned with and is either an involuntary expression of satisfaction, or it is being used as a communication device. You may notice involuntary satisfied grunts when your dog is enjoying a petting or grooming session, relaxing at home, or even sometimes when it is sleeping soundly. Communication. Grunting as a communication sound is often heard during greeting sessions, as a method of begging, and sometimes during play. Although dogs that are bred to have shorter faces, such as pugs and bulldogs, may be predisposed to developing respiratory disorders, they are also more likely to use grunting to communicate. Gastrointestinal problems. Some of the most severe digestive orders that may be indicated by grunts include bloat and pancreatitis. If your usually quiet dog begins grunting and showing signs of discomfort, a call to the veterinarian is recommended, particularly if this happens after eating. Laryngeal paralysis. When the laryngeal nerve stops working properly, the muscles in the throat don't open efficiently, making it difficult to breathe. This can result in strange grunting sounds frequently accompanied by lethargy and a change in dog's voice, and may require surgery to correct. Pain. Dogs respond vocally to pain in several ways, including growls, whines, yelps, and grunts. If your dog grunts and moves away when you touch them, it may be an indication of pain. Those with chronic pain such as arthritis or dental disease may also grunt more during their day-to-day life. Respiratory disorders. Many respiratory disorders are associated with grunting and coughing noises. If coughing, sneezing, or snorting noises are occurring at the same time as the grunting sounds, then a respiratory disorder may be responsible for the symptom. What to do if your dog is grunting? The best response to grunting will depend on if additional symptoms are present as well as the animal's overall behavior. Most of the time, simple grunting from your canine does not require any sort of treatment. It is a natural vocal response to many situations. However, when it becomes chronic, is accompanied by other symptoms such as difficulty breathing, flinching from touch, or other signs of discomfort or pain, it may require additional consideration. Dogs that are snuffling and snorting along with the grunting may need to be evaluated to ensure that there are no impediments to their breathing. If the respiratory sounds are accompanied by shortness of breath, a vocal change, or coughing, there may be a serious underlying condition. Depending on the diagnosis, treatment may require antibiotic or anti-inflammatory medications, or in severe cases, surgical intervention. Dogs with short noses, also referred to as brachycephalic dogs, may suffer from a disorder known as brachycephalic obstructive airway syndrome, BOAS, which is manageable with veterinary assistance, although not curable. If your dog is flinching from touch when the grunting occurs, you will want to watch for other signs that the dog may be in pain, such as obsessively licking a certain spot, dilated pupils, and increased heart rate, blood pressure, and respiration. Depending on the location and severity of the pain, your veterinarian may recommend over-the-counter anti-inflammatory medications, or may request that you bring the dog in for a more thorough physical examination. If your dog is also stretching his legs out far in front of it and arching the back, he may be trying to relieve pain in the abdomen or back. If this behavior, known as the position of relief, or the dog praying position, is exhibited by your dog, you should contact a veterinary professional immediately, as this may indicate a serious condition such as pancreatitis, intussusception, or bloat. Prevention of grunting. Although grunting itself is not generally considered a medical disorder that requires prevention, many of the disorders that it can characterize may be prevented. Because of laryngeal paralysis cannot be prevented, the risk of trauma can be lessened by monitoring your dog close and ensuring they are not put in dangerous situations, e.g., with unknown dogs, as uncontrolled hypothyroidism can also be a cause. Ensure any hormonal disorders are well managed with medication. Dogs that are prone to bloat should be prevented from gulping their food. This can be accomplished by feeding the animal in multiple smaller portions rather than just one or two large meals, and choosing food bowls designed to slow the dog down while it is eating. Choosing food with fewer carbohydrates and delaying exercise after eating may also reduce the chances of developing this dangerous condition. For those at highest risk, a preventative surgery called a gastropexy may be considered. Cost of grunting. The cost for treatment in regards to symptomatic grunting depends greatly on the underlying cause of the vocalizations. The average cost for disorders that are characterized by grunting can vary greatly. Minor trauma may only cost a few dollars for anti-inflammatories. Laryngeal paralysis generally runs around $2,000, while bloat has an average treatment cost of around $5,000 to treat.